Yesterday, the state confirmed 11,736 cases of coronavirus in the Commonwealth of Massachusetts with 216 deaths. Today in Boston, we are up to, this includes today's numbers for Boston. I don't have the state's numbers yet. 1,877 cases in the city of Boston. That's up 259 cases over yesterday, our largest single day increase. We've had 2 deaths, which total 15 people in Boston have lost their life to coronavirus. And what all this means is in the last 48 hours, we've had an increase of 511 new cases. That's 27% of our overall cases of coronavirus since this began over the last 48 hours. That's what a surge looks like, and we are still at the beginning of the surge. As I said before, this is an unprecedented situation. It has asked a lot from all of us. It's going to ask more from us over the next few weeks, and I'm confident that Bostonians will rise to that challenge. We continue to draw inspiration from the frontline heroes who are keeping us safe, and we continue to follow the recommendations of the public health experts who we're learning from the outcomes around the world and gathering data and compiling it to see exactly what does this all mean. As of this weekend, we have new data on the surge of cases that begun here in Boston and Massachusetts. We have updated models of what the curve could look like over the next 2 weeks, and we have new guidelines from the CDC and local health experts about what we should do to protect our community. What the data continues to show is that right now, every single day is critical to saving lives in our city. And what that model continues to show is that distance and distancing will make that difference. So we need to keep doing what we've been doing, and we need to do it even better. For that reason, I'm announcing new, stronger stay-at-home guidelines to help us get through this. These go into effect tomorrow morning, April 6th, and will run through April 4th, which matches the current state advisory. First, I'm asking everyone and anyone to wear a mask covering their face when you leave your house. That means shopping, going for a walk. That means working on a construction site or at work. Any essential workers, we're asking you to do the same thing. Anything outside your home. This is the new CDC recommendations for slowing the spread of the virus. It's important that we preserve medical-grade masks for healthcare workers and direct responders. But we can all help slow the spread by covering our faces. It's important to understand that covering does not protect you from infection. Physical distancing is still 100% necessary. You need to keep at least 6 feet away from other people, even when you're wearing a face covering. But face coverings will help slow the spread of the virus. That's because up to about 25% of the people who are infected are not showing symptoms right now. Many are still out and about because they don't feel sick. So the more of us who wear coverings, the more effective that this strategy will be. The covering can be a scarf, a bandana, or any other type of cloth. It should cover your mouth, your nose, and allow you to breathe comfortably. We will provide face coverings to city employees who must work outside their home, and we're going to provide advice and resources to anyone who needs them, either making them at home or getting them. Employees who work in a setting where personal protective equipment guidelines have already been issued should continue to use the PPE in accordance with those guidelines. The face covering that I'll be wearing after the press conference today is made by City Councilor Nisra George. She is part of the Boston Area Mask Initiative, who are collecting masks for hundreds of volunteers, who are collecting and making masks for hundreds of volunteers and giving them to people who need them, including hospital, medical staff, and direct service workers. I want to thank Councilors Nisra George, I want to thank Karen Foley and Stephanie Cave, who started this effort. Anyone who would like more information on this can go to bostonareamaskinitiative.gov.com to get involved. That's bostonareamaskinitiative.com. Secondly, we're strengthening the stay-at-home advisory by adding recommended curfew for at least the next 3 weeks in Boston. The Boston Public Health Commission is issuing a public health advisory recommending that people stay inside between 9 p.m. and 6 a.m. starting tomorrow morning. It applies to everyone except essential workers. That gives people a clear guideline to help them plan their day, make good choices, and avoid crowded situations. We have seen too many unnecessary trips in the evening and social distancing problems as people order and wait for takeout restaurants. If you're getting food from a restaurant after 9 p.m., we ask you to use the delivery services as much as possible. And to be clear, any time of the day, we're asking you, that's when you can go out for essential items. If you're not at a grocery store, pharmacy, or restaurant, if you're not in a group, you're not there to browse for extra items in the supermarket, you're not there to socialize, you're there to get what you need and get home. I can also share new steps we're taking at City Hall. Starting this week, City Hall will be open for the public only on Tuesdays and Fridays between 9 a.m. and 5 p.m. This week, City Hall is only open on Monday. It will be closed on Friday because of Good Friday. In addition, everyone entering the building, employees and members of the public, will be subject to screening for the COVID symptoms, including temperatures. It's still the case that you should only come in for services if they're not available by phone or online. We're asking people, you must call ahead to schedule an appointment. The pause on non-essential construction also remains in place. And I want to say to developers and general contractors, even if your job site or your construction site is allowed to function under the current guidelines, if you don't absolutely have to work right now, shut it down. We are at the beginning of the surge. Every step we take to limit the number of people working together will make a difference. If you can wait a few weeks, wait a few weeks. Use common sense. Put people before profits. Finally, we're also going to close sports facilities at city parks, such as basketball, tennis, and street hockey courts. People are continuing to gather, and we simply have to take that option away. You will still have access to open space where you can practice physical distancing or go for a walk or a run. But no group activity should be taking place anywhere, and that includes fitness classes in open spaces. We've posted signs in all of our parks and playgrounds, and we're locking up or disabling equipment. As a reminder, police officers are empowered to disperse gatherings under the state advisory, and they can order people to vacate closed sections of parks, and if need be, if it comes to this, they can and will issue violations. But it shouldn't have to come to that. We are urging people to use common sense so that police are not put in a position where they need to do this. Ultimately, this is about doing what we have to do and what we have been doing to get better. So I want to repeat the basics. Stay at home. Only to go out for essential supplies, food, and medicine. When you do go out, maintain 6 feet from other people in public. If you're in a supermarket or a sidewalk, be aware of your surroundings. Don't be that person strolling down the middle of an aisle and making everyone else move. Let's use some teamwork here to move forward. If somebody's approaching you on your path for a walk, or you want to get out of the way, just look for a safe space and just take a side step to the side. Let's give each other space here. There should be no gatherings or crowds anywhere for any reason. If you see crowded conditions where you're headed, turn around and change your plans. No visiting or meeting up with friends or family who are not part of your household, period. Wash your hands often with soap and warm water. Use hand sanitizer. If you come in from being out for whatever reason it is, wash your hands immediately and disinfect anything that you touch. If you need to scratch your nose or wipe your mouth, stop and wash your hands first. We're asking you to cover your cough and your sneezes. Wear those face coverings when you go outside your home. And remember, if you live with an elderly person or somebody with a health condition, every time you go out and you come back in, you put them in danger until you've washed your hands, changed your clothes, and cleaned the door handles on your surfaces. I want to speak directly to the people who are at higher risk, our seniors and people with health conditions. We're asking everyone to do all they can to avoid transmitting the disease to you. We're also reminding you to take extra precautions. Only go out when you absolutely need to. That means for food or medication. For the next couple of weeks, instead of taking a walk or exercising inside your home, we ask you if you can exercise inside your home to keep you safe. We can help if you need advice or services. We're asking you to call 311. I want to remind everyone what some of the underlying health conditions are and how common they are. Asthma, diabetes, heart condition, kidney or liver disease, cancer treatments, these are not rare conditions. We all know people who have them. Over 11% of Boston residents have asthma. In Roxbury and Dutch, that number goes to 15%. One out of four of our high school students citywide. Wherever you are in our city, you need to realize how many people are vulnerable, and they're all around you. That brings me to the youth and young adults. I want to address you directly. So far in Boston, nearly 45% of all positive tests are people under the age of 40. We are now seeing more cases of severe illness in young people. But whether you get sick or not, you have a responsibility. You have to follow these guidelines. Otherwise, if you live with a grandparent, you put them at risk. If your parent is over 60 and has a health condition, you put them at risk. If you have a brother or sister with asthma, you put them at risk. It's not normal for me to get up here and scare the people of Boston as the mayor. But this is not a normal situation. This is a moment that we need people's attention. We need you to know and share this information. We need everyone to act on this together as one city right now in the days ahead. We're doing everything it takes to be ready for the surge. I also want to give you an update on the work expanding treatment capacity of the healthcare systems. We are making swift progress at the Convention Center in South Boston. By the middle of this week, we will have created 1,000 beds, hospital beds, 6 acute care suites, let me correct that, 1,000 beds, 500 for homeless and 5,000 for hospital capacity, 6 acute care suites, a physical therapy suite, 52 nurse stations, and 48 bathroom facilities. This was done in 4 days. I want to thank everyone who's made this happen. I want to thank David Gibbons and his team at the Mass Convention Center Authority. I want to thank Suffolk Construction. I want to thank the architects of the Mount Vernon Group. I want to thank Select Demo, working with the building trades, including the laborers, carpenters, and painters union. I want to thank Corp Events New England and the Teamsters. It's an incredible team effort. We are preparing for whatever comes our way, for our vulnerable residents and for all of our residents. But what we don't want is to have to test the limit of this new medical capacity. And that's why these stay-at-home measures are so essential. We will get through this, but I need everyone to understand what it will take from each and every one of us. I need everyone to understand the seriousness of this situation. Lives are literally at stake. I am not willing to look back 2 or 4 weeks from now and look at that number thinking that we could have done more. We must act now, all of us. It's our responsibility. I want you to understand that the most important message is we are not powerless. This is the point of our guidelines. They empower you, they empower me, and all of us to fight this virus. We're going to see numbers and we're going to see them going up over the next several days and weeks. It's going to be difficult, but don't just focus on the numbers going up. Think about the numbers that we don't see. Think about the cases that you individually have stopped and the lives that you individually have saved by doing the right thing. What we do now and over the next 2 weeks will make a difference for some people between living and dying. I want to thank the residents of Boston for all that you've done already. I want to thank you for everything that you continue to do. I want to thank our nurses, our doctors, our first responders, and all the folks that are working there to make sure that we continue to move forward as a society. I want to thank you for staying safe. I want to thank you for staying inside your home. And I want to thank you for staying Boston strong. With that, I'll take some questions. The question is can I explain how frustrating it is to see people still going outside and basically ignoring the guidelines? In some cases, it's just astonishing, quite honestly. This is a serious virus. Yesterday, I went for a walk myself, and when we were walking, everyone was keeping social distancing, and people were moving off the street when we were kind of walking, respecting each other's space. But I walked by a tennis court, and I saw people playing in there. And, you know, you might think that you're being safe in there, But what you're doing is, if you have a couple people playing tennis and you're not the same family, you potentially are putting people at risk and taking that virus. Yesterday, I got calls of people being at the Arboretum, hundreds of people being there and not practicing social distancing. I know it was a beautiful afternoon to go for a walk. You're not helping each other out. I heard stories of people down Castle Island, same thing. Listen, these are great places, and I love all these places I'm mentioning, but it's about keeping people safe. And I think that a lot of people, you can just walk around your blocks and your houses, your neighborhoods. You don't have to go to a destination to go for a walk. You can simply walk outside the front door and walk around your neighborhood if you want to do that. I was talking to Mayor Curfew yesterday from Somerville, and he was doing that, walking around his neighborhood, and they have a lot of places. So I just don't know what more we can say. I mean, we're obviously enforcing stricter advisories here today, and I'm not doing it because we want to do it. We're doing it because we have to do it, and we're doing it because we're seeing these numbers surge. 27% increase in positive cases in Boston over the last 2 days. That's an alarming number. If those numbers continue to increase, it's going to be a problem. So. Yeah, does it bother me? Does it frustrate me? I just think for each and every one of us, we have a responsibility to our fellow citizen and to our family.